Top 25 care home assistant interview questions and answers. Working as a care home assistant requires compassion, patience, and dedication to improving the quality of life for residents. Employers look for individuals who can provide physical, emotional, and social support while maintaining a safe and respectful environment. Preparing for an interview helps you express your genuine care and professionalism effectively. Below are the top 25 care home assistant interview questions and well-crafted 80-word answers to help you succeed. 1. Why do you want to work as a care home assistant? I have a strong desire to make a positive difference in people's lives, especially the elderly and vulnerable. I find great satisfaction in offering emotional support and ensuring residents feel valued and comfortable. The role aligns with my caring nature and commitment to promoting dignity and respect. I also appreciate that this job allows me to learn daily, build meaningful relationships, and contribute to residents' overall well-being. 2. What do you think are the most important qualities of a care home assistant? The most important qualities include compassion, patience, empathy, reliability, and good communication. A care home assistant must treat residents with respect, understanding their emotional and physical needs. Being observant and attentive helps identify changes in residents' health. Additionally, teamwork, flexibility, and maintaining confidentiality are crucial. Combining these traits allows a care assistant to provide effective support and foster a positive, trusting environment within the care home. 3. How would you handle a resident who refuses to take their medication? I would remain calm and respectful, trying to understand the reason for refusal. It's important to communicate patiently, explain the medication's purpose, and reassure the resident. If they still refuse, I'd document the incident and inform the nurse or supervisor immediately. Building trust and ensuring residents feel heard often reduces resistance. My approach would always respect their dignity and follow the care home's policies. 4. Describe how you would maintain a resident's dignity while providing personal care. Maintaining dignity means respecting privacy and ensuring the resident feels comfortable and valued. I would always explain each step before providing care, close curtains or doors to privacy, and offer choices whenever possible. I'd speak respectfully and avoid making the person feel embarrassed or dependent. Preserving dignity also involves encouraging independence and listening attentively to their preferences, fostering a sense of trust and self-worth. 5. How do you deal with a difficult or aggressive resident? I would stay calm, patient, and non-confrontational. It's essential to understand that aggression often stems from fear, pain, or confusion. I'd use a gentle tone, give them personal space, and avoid taking things personally. Afterward, I would document the incident and inform my supervisor. Reflecting on triggers can help prevent recurrence. My goal is always to de-escalate the situation safely and preserve the resident's dignity. 6. What steps do you take to ensure resident safety? Resident safety is my top priority. I always follow care plans, use correct moving and handling techniques, and maintain a clean, hazard-free environment. I'm vigilant about infection control practices, including proper hand hygiene and PPE use. I promptly report any concerns, incidents, or maintenance issues. Monitoring residents for physical or behavioral changes also helps identify risks early, ensuring quick intervention and consistent safety. 7. How do you support residents' emotional well-being? Supporting emotional well-being involves showing empathy, listening actively, and providing companionship. I take time to engage in conversations, encourage participation in activities, and show genuine interest in resident stories. Small gestures like a smile or gentle reassurance can make a big difference. I also respect their individuality, cultural background, and choices. Promoting a warm, inclusive environment helps residents feel valued, secure, and emotionally balanced. 8. How do you handle confidential information? I strictly follow data protection and confidentiality policies. Any personal or medical information shared with me remains private unless disclosure is necessary for safety or required by law. I ensure that records are stored securely and never discuss residents' details outside a professional setting. Confidentiality builds trust and demonstrates respect for residents' rights and dignity, which is fundamental in care work. 9. How do you manage your time during a busy shift? I prioritize tasks based on residents' needs and care plans. Starting with essential duties like medication or personal care ensures critical needs are met first. I stay organized, plan ahead, and communicate with my team to share workload efficiently. Flexibility is key, as unexpected situations can arise. Staying calm and focused allows me to deliver consistent, high-quality care even in busy circumstances. 10. Describe a time when you went above and beyond for a resident. Once, a resident felt isolated after losing a family member. I spent extra time with them, listening and engaging them in light conversation. I coordinated with the activities team to organize a small memorial gesture, which brought them comfort. Seeing their mood improve reminded me that emotional support is as vital as physical care. It was rewarding to know my compassion made a difference. 11. How do you ensure infection control in a care setting? I follow strict hygiene protocols, including hand washing before and after care tasks, wearing appropriate PPE, and properly disposing of waste. I ensure surfaces and equipment are sanitized regularly. I also educate residents, when possible, about hygiene practices. By maintaining cleanliness and adhering to infection control policies, I help prevent the spread of illness and create a safer environment for both residents and staff. 12. What would you do if you notice a colleague mistreating a resident? I would intervene immediately if it's safe, to stop the mistreatment. Then, I would report the incident to my supervisor or safeguarding officer following proper procedures. Documentation is essential to ensure accountability. Residents depend on staff for their well-being, so safeguarding them is a moral and legal duty. I believe speaking up protects vulnerable individuals and maintains the integrity of care services. 13. How do you support residents' independence? Supporting independence involves encouraging residents to do as much as they can safely. I provide assistance only when necessary, allowing them to make choices about daily routines like clothing or meals. I also use adaptive tools and positive reinforcement to promote confidence. This approach enhances their self-esteem, preserves dignity, and helps them maintain a sense of control over their lives. 14. How do you handle stress at work? I manage stress by staying organized, communicating openly with colleagues, and maintaining a positive attitude. Taking short breaks when possible helps me recharge. I also reflect on challenging situations to improve future responses. Outside work, I practice relaxation techniques and maintain a healthy lifestyle. Recognizing that care work can be emotionally demanding helps me stay resilient and focus on providing quality care. 15. How would you handle a medical emergency in the care home? I would stay calm, assess the situation, and follow emergency procedures immediately. I'd alert the nurse or supervisor, call for medical help if necessary, and ensure the resident is safe. While waiting for professionals, I provide appropriate first aid within my training limits. Afterward, I would document the incident accurately. Acting quickly and calmly ensures the resident's safety and demonstrates professionalism. 16. How do you build trust with residents? Building trust requires consistency, respect, and active listening. I take time to know residents personally, understanding their preferences and routines. I communicate clearly, maintain confidentiality, and always follow through on promises. Being patient and empathetic helps residents feel comfortable sharing their concerns. Over time, these behaviors establish a strong bond of trust and promote a positive caregiving relationship. 17. Describe how you work effectively in a team. Teamwork in care involves open communication, mutual respect, and reliability. I actively listen to colleagues' input, share relevant updates, and support others during busy periods. I understand that consistent collaboration ensures smooth operations and better resident care. By maintaining a positive attitude and resolving conflict professionally, I contribute to a supportive team environment focused on shared goals. 18. How do you handle residents with dementia? I use patience, empathy, and clear communication when caring for residents with dementia. I speak calmly, use simple language, and maintain a reassuring presence. Understanding their triggers helps prevent agitation. I also focus on creating familiar routines and using memory aids. Above all, I treat them with dignity and compassion, ensuring they feel safe, respected, and valued despite cognitive challenges. 19. What motivates you in this job? The biggest motivation comes from knowing I'm making a difference in someone's life. Seeing residents smile, gain confidence, or express gratitude gives me fulfillment. I'm also motivated by learning opportunities within healthcare and teamwork. Helping others live with dignity and comfort drives my passion for caregiving and encourages me to continually improve my skills. 20. How would you handle complaints from residents or families? I would listen carefully without interrupting, showing empathy and understanding. It's important to acknowledge their feelings and apologize if appropriate. I'd aim to resolve the issue promptly within my responsibility and inform my supervisor if needed. Documenting the complaint ensures proper follow-up. I view complaints as opportunities to improve care and strengthen trust between residents, families, and staff. 21. How do you communicate with residents who have hearing difficulties? I ensure I face the resident, speak clearly, and maintain good eye contact. Using simple language gestures or written notes helps improve understanding. I remain patient and confirm they've understood by repeating key points. I also minimize background noise and use hearing aids correctly if applicable. Adapting communication methods ensures inclusivity and reduces frustration for the resident. 22. What would you do if a resident fell? I would not move the resident immediately, but check for responsiveness and visible injuries. I'd call for medical help and inform my supervisor. While waiting, I would reassure the resident and keep them comfortable. After the incident, I complete necessary reports and monitor them closely. Following safety protocols ensures proper care and prevents further harm. 23. How do you support residents with special dietary needs? I follow care plans and dietary instructions closely, ensuring meals meet medical and cultural requirements. I communicate with kitchen staff about allergies or restrictions and monitor food intake. Encouraging residents to eat while respecting preferences is vital. I also report any appetite changes or swallowing issues to nursing staff. Proper dietary support promotes health, safety, and well-being. 24. How do you handle end-of-life care? End-of-life care requires compassion, sensitivity, and respect. I focus on ensuring comfort, dignity, and emotional support for the resident and their family. I follow care plans, provide reassurance, and communicate openly about needs. I maintain a peaceful environment and work collaboratively with nurses and families. Offering presence and empathy helps ease the process for everyone involved. 25. What do you enjoy most about working in a care home? I enjoy building meaningful connections with residents and witnessing the positive impact of compassionate care. Each day offers new learning opportunities and moments of appreciation. I value the teamwork and sense of purpose that come with supporting others. Knowing my work contributes to residents' happiness and comfort gives me a deep sense of fulfillment and pride. Care home assistants play a vital role in enhancing residents' lives through empathy, patience, and professional care. Preparing thoughtful answers to interview questions demonstrates both competence and compassion. Employers seek candidates who balance skill with heart. By reflecting on these examples, you'll be ready to showcase your strengths, values, and genuine dedication to providing exceptional care in any residential or nursing home setting.